Hello, everyone. I'm Lorna Warwick, the CEO of the Lymphoma Coalition, a proud member of the Global Cancer Coalitions Network, or GCCN, alongside the Advanced Breast Cancer Global Alliance, the Global Colon Cancer Association, the Global Lung Cancer Coalition, the International Brain Tumor Alliance, the International Kidney Cancer Coalition, the World Bladder Cancer Patient Coalition, the World Ovarian Cancer Coalition, and the World Pancreatic Cancer Coalition. It's my pleasure to welcome you all here today for our first Coalition Connection event on the impact of COVID-19. If you have not heard of the GCCN before, that's probably because it is fairly new. The GCCN was established in May 2020 in response to concerns about the impact of COVID-19 on our member organizations. Collectively, the GCCN represents some 750 cancer patient advocacy and support organizations who are working on behalf of over 14 million patients around the world. The network came together to share experience and best practice, a process we have found invaluable during the pandemic and one that we plan to continue. Before we start, I would like to extend our thanks to Open Audience, the company behind the technology we are using today. They have been very generous in providing their time and resources at no cost. We could not have done this without you. And speaking of technology, I want to take a minute to ensure you have the information you need to fully participate in today's event. As you are watching your screen, you will see on the right are 3 tabs. The program tab has today's agenda listed. The Q&A tab is in the middle, and it is in there you can add any questions or comments you may have during the presentations. Click on the Submit New Question button and type in your question or comment in English or in any language of your choice. What you typed will appear on the screen in the language you typed in, as well as English. If you agree with a comment or a question someone else has added, you can like it or upvote it by clicking the arrow next to the question. This will help us see what the most popular questions or comments are when we have time for Q&A. The final tab is Materials and includes the report we are launching today, as well as the GCCN COVID-19 Joint Statement updated in December. We will also have 2 audience polls today. The first one is asking you to choose the category that best fits your role in the cancer community, so we have a good understanding of our audience. So please complete the poll if you have not done so already. Now we have the poll results coming up, and it's good to see the number of patient organizations that are engaging with us today. Also, some participation from cancer patients themselves, as well as other valuable members of the community. It's good to see you all with us. When we decided to do this event, we knew there was no better day to launch than on World Cancer Day. One of the themes of World Cancer Day is working together as one, which accurately reflects why the GCCN was formed. As such, we are pleased to share a welcome video from Dr. Carrie Adams, the CEO of the Union for International Cancer Control, or UICC.
Hello everyone, my name is Carrie Adams and I'm the CEO of the Union for International Cancer Control in Geneva, Switzerland. I appreciate the opportunity to say a few words at the opening of your World Cancer Day event. Thank you particularly to the host and organiser, Global Cancer Coalition Network, a valuable member of UICC. For the team here at UICC, along with the rest of the world, World Cancer Day on the 4th of February is an important occasion that we look forward to every year. It's a valuable opportunity to recognise the entire cancer community and the critical work that everyone is doing, including cancer organisations, researchers, healthcare workers, to companies and even government agencies. Particularly this year, as our community continues to face one of the most challenging times, the coronavirus pandemic has caused significant disruption and devastation over the last 12 months, and it will continue to be a challenge for our community. Today, what we need to do is to come together. Collective action, collective effort between governments and the international community is what is required to achieve our goals in ending cancer inequities. We are supporting and assisting our members to drive action at a local and national level through capacity building initiatives, knowledge sharing and more. USC delivers all of its programs in partnership with members and partners and leveraging the community of experts across all areas of cancer control and the broader health community. We cannot do this alone, and I appreciate the work that everyone at your event is doing to ensure that as a country you are having these active discussions and exchanges. This year's World Cancer Day theme of I am and I will is therefore even more relevant today. It's critical that we all come together in the spirit of the theme and show the world that we are committed to taking action. We can all do something, whoever we are. And I would love to know what your commitment is for this final year of the theme I am and I will. So who are you and what will you do? Let us know and help us spread the word this World Cancer Day. I encourage you to learn more about World Cancer Day and how you can get involved with the supporting of the work of the cancer community more generally. Visit our website at worldcancerday.org to find out more and take part in the activities there or become inspired by the stories that we share. So thank you for joining me with me, along with thousands and thousands of people, to show that when we are unified, that our message and actions are that much more powerful. I wish you an excellent event and a wonderful World Cancer Day. Thank you.
Our first session will focus on the results of the Patient Advocate Organization survey on the impact of COVID-19 conducted at the end of 2020. Presenting will be Frances Reed, Program Director from the World Ovarian Cancer Coalition. Frances had a very key role in actually making the survey happen and then also analyzing the data. So there is no one better for you to hear from today than Frances with her inside knowledge.
It's an honour to be presenting the results of this survey to you all. So we have 9 members of the Global Cancer Coalition's network, and 6 of them took part in this survey. The other 3 already had work out with their member organisations, so were unable to participate at this time. You'll see here the organisations taking part in this survey. It is in fact the second survey that we've done. We undertook the first one in June 2020 as the pandemic really was taking hold. The results of that survey gave very dire predictions for the state of cancer patient organisations through the pandemic. It showed a real struggle to cope with the changes that needed to be implemented. We wanted to see in December 2020 whether those predictions came true, what had started, what had stopped, what had changed, and what were the current issues still remaining for cancer patient organisations. We had approximately half of our most recent participants. They also took part in the first survey. For the December 2020 survey, we had 104 responses from 44 countries. Most were in the second or even third waves of the pandemic, and we had a really good range of countries, as you can see from this slide. When we look at participating organisations by cancer type, you should be able to see, it's not loading correctly, but we actually had a really good representation from the different cancer types. And just the pink pie chart was actually organisations that dealt with all types of cancer. So it was a really good representation of the different organisations. We asked the organisations what they had been doing prior to COVID and how they were structured. And it was interesting to note that just under a third had no paid members of staff, so run solely by volunteers. But volunteers played a really vital part in all the organisations. And we asked them about the number of active volunteers in each organisation. And you can see that the average number was 369. For a third of the organisations, they had 5 or fewer members of staff. And for only just over a third, did they have considerably more than 5 members of staff. So what happened during the pandemic? You can see here that for those organisations with staff, the average number of full-time equivalent staff fell from 21.2 to 17.4, a drop of nearly 1 in 5 posts, a really significant drop. The average number of volunteers per organisation fell from 369 to 107, a massive drop of 70%. We rely so heavily on the involvement of volunteers in our work. The majority are either fully or mainly home-based since the beginning of the pandemic. Many volunteer organisations worked in that way already, but a considerable shift since the pandemic began. And 2 organisations have had to close permanently, and another 13 have had to pause their services temporarily due to local restrictions. We asked people what had started, what had stopped, and what had altered, and I'll talk you through this graph. So on the left-hand side, we have the proportion of organisations starting new services, and the red bar is very much COVID-19 for cancer patients and their caregivers. And the next most common start of services was online support services. And that fitted when you looked at what had been stopped. Much face-to-face, if not all face-to-face support services had been stopped as a result of the pandemic. But there were also events like annual meetings, health professional education that also had to stop. And the bars on the right-hand side of the chart show that there was very much that had to be altered throughout the course of the year, including things like influencing, lobbying, awareness raising, and so on. Most of our organisations, 8 in 10, run helplines or take email inquiries from patients and caregivers. And of these, over half saw an increase in calls, with the average increase in calls and emails of around 46%. These went up right at the beginning of the pandemic. Some remained high and some fluctuated together with the levels of the pandemic in the country. The chart on the left shows you that the most common questions were based around treatment. How is my treatment affected because of the situation? You know, people were being moved off treatments, appointments were being delayed and so forth. So there was much concern about treatments. Next most common bracket was the risk of COVID-19, both for patients themselves, but also their caregivers, concerned that they might pass the disease on to others. And a lot of inquiries about mental health needs as well. Obviously, technology has played a really big role in how organisations have coped, and this may be quite new for some organisations. Just under 3 in 10 said they have fully adapted to the new role of technology, and 6 in 10 to some extent. But 1 in 6 have had to spend money on being able to utilise technology better, and almost 1 in 3 have had to acquire new digital expertise. 1 in 10 still need help to adapt, and for 1 in 10, access to internet and Wi-Fi is still a real issue that is holding them back. We asked people for the positive and the negative aspects of technology. One of the positives, being able to reach new audiences, wider audiences. But there were concerns about digital deprivation, particularly amongst the elderly, amongst people who cannot afford data and internet connections, or in areas where internet services and Wi-Fi is very limited. It opened up access to events and support services for those who are in hospital, sick, or those who were unwell and not able to travel some quite considerable distances to events and so forth. And it also made communication more immediate with people. You could reach out very quickly to them. But there is concern that that level of communication is less impactful as a result, and it's not as easy to build personal relationships. Overall, 8 in 10 of the organisations said technology has really redefined their relationships with patients and caregivers and those who raise funds for them. Half of the organisations we surveyed either fund or undertake research themselves. and the future remains somewhat uncertain. Currently, around a third of projects are either still paused or have a reduced scope. Some has gone back to normal, but there are queries about future funding. Half expect to be able to resume their projects and funding going forward. Those who kept their current projects going during the pandemic are less certain for future funding rounds. But those who have paused or reduced scope are currently more certain about the new projects. And there are concerns on the long-term impact for the sector as a whole, with cancer researchers moving on to more secure jobs, and there being less of a focus on perhaps rarer cancers and those that are more difficult to treat. In terms of cancer diagnosis, we asked the organisations what the situation was in their country, and it's still a fairly grim picture. The pink bars on the left of each category, they show services that are back to pre-COVID normal, and there are very few. Some are improving, but for some, things are even worse than ever, and this goes across screening programs, urgent investigations, people seeking help from their doctors, pathology services as well. When it comes to cancer treatments, it's a very similar pattern. Very little is back to pre-COVID normal. Some improvements, but in some categories, some really important categories, still the same as at the beginning of the pandemic or worse than ever. And it's an even more grim picture when we look at the impact on patients. So in terms of levels of stress, anxiety and depression relating to COVID-19 and the impact on their care, the level of isolation for patients, and the level of financial hardship, you will see by far the most common categories are that it is worse than ever. And it is the cancer patient organisations who provide such a vital service for these patients. And this is why it's so important that they are able to continue their work. The not-for-profits, our member organisations, really have stepped up in terms of adapting their services, but they've also been involved in discussions with cancer groups, other health charities, healthcare professionals and policymakers about how to get cancer services back to normal. Of those involved in discussions, informal talks are more common than formal talks, and only 1 in 4 have been involved in formal consultations at a national or regional government level. We have so much to contribute in this field. It's noted that all of those organisations who were in formal discussions were from high-income countries. 1 in 10 say that sustainable lessons have been learnt by those in health policy in relation to cancer care in the pandemic. A further 4 in 10 say lessons have been learnt to some extent, but for a third, they say there is a real danger of lessons not being learnt and mistakes being repeated. Can our organisations weather the funding storm? This was a big question. Back in June, the predictions were dire. 79% of those who were raising funds, and that is the majority of our organisations, were predicting a fall in income over the year, and they were predicting an average fall of around 46%, and only 5% didn't expect to see their funds fall. What was the reality? Not far off, I'm afraid. Over 2/3 experienced falls in income, with an average fall of 48%, so their income halved over the year when they were changing their services, losing staff, having to adapt and having to deal with increased need. 21 organisations from 18 mixed countries, so high, low and middle income countries, experienced falls of more than 50%. And I'm afraid to say that ovarian and pancreatic groups seem to have been hit the hardest. If you look at the pink bars on the graph, they had over half of their organisations had drops of more than 50% in income. It was interesting to note, though, the dark purple bars were organisations, proportion of organisations which didn't experience any drop in income. And those that dealt with all types of cancer were least likely to experience falls in income. What type of fundraising was affected? Every type of fundraising was affected. It's not surprising, perhaps, that not-for-profit, their own events, their own fundraising events were severely impacted because they could no longer take place in a face-to-face fashion. Community fundraising, postal donations, public collections, you name it, it was affected. Corporate donations, farmer donations, grants and foundations, major donors, every aspect were affected in some organisations. Those that were least likely to be affected were those getting some pharmaceutical support. So some organisations did well, others didn't do well on that front. We looked at all those organisations that didn't have an overall fall in income. And when you looked at their answers to these questions in front of you, it showed they still had a really challenging time. So they experienced quite considerable drops in some areas, but fortunately were able to make it up in others. Government emergency funding. So nearly 6 in 10 reported that no emergency government funding scheme existed in their country. And that was from a total of 29 of the 44 countries. And only 14 out of the 104 organisations had successfully applied for emergency government funding. And the ones that were successful were all in those high income countries shown on the slides below. But when you looked at even those that got emergency government funding, 12 of the 14 still experienced a considerable drop in income of, on average, 27%. Income predictions for 2021, not much better, I'm afraid. So if you look at the dark blue segment, just over 1 in 10 are predicting that their income will return to levels seen in 2019 or be higher. The teal colour below that is nearly a quarter saying funding will improve, but not to the levels seen in 2019. Over a third are saying that income is likely to be the same as this year. And for 1 in 6, they are predicting further drops in income. 1 in 10 say their current viability is threatened right now. And a further third say their future viability is uncertain. This quote sort of sums up the reality, really, and it is from one organisation, even though it's in 2 parts. We launched a new virtual event, a week-long event. We added a new mobile donation software platform to support easier engagement, along with a communication strategy to support our fundraisers. It was effective, and we learnt a lot from the experience that we will take into building upon this year's event in 2021. But there's a caveat. It's been more intense and worrisome, especially given we had to eliminate the fundraising staff position due to anticipated reduction in funding. This has left the fundraising work to be distributed among the remaining 5 staff members. Some really, really difficult decisions having to be taken. People were very good at offering their experience and advice to others. This is such an interesting time for us to evaluate how we do our work moving forward, so we don't just go back to how we used to do things. We should look at this as the tipping point for us to reimagine and be forward thinking in terms of how we want to collaborate, connect, and create community in a different model. Other bits of advice were more succinct. Embrace digital. Lessons learnt, keep asking, trial quick, move on. And another one, asking and communicating with our patient community and fundraisers has helped us craft a better strategy for engagement. But there's a real cost to the staff, to the volunteers in these organisations. A lot of burnout, a lot of very tired people dealing with some very difficult issues. Some advice from one of the leaders of one organisation: keep up communication with your staff, keep positive, provide them with online tools, acknowledge the challenges often, and make it okay for staff to express their vulnerability. Provide wellbeing sessions via Zoom, Friday night drinks via Zoom, celebrate wins, focus staff attention on any blessings of COVID. Our message from the Global Cancer Coalition's network to you all: cancer care cannot and will not wait for COVID-19 to pass, if it ever will. You, our member organisations, provide essential services filling really important gaps that are often not filled by health services. As organisations, you are not alone. We will champion your cause. Please use the report to ask for funds. Use it to show the situation that you are facing and the important work you are doing. Network and collaborate as much as you can, and please try to take the positives forward. On a final note, you cannot look after others if you do not look after yourselves. Thank you for your time. The report is available on the event platform to download, and it's also on the various coalition websites. It also includes additional material by the International Brain Tumour Alliance, who had just published the results of their own survey. I'm very happy to receive questions via email after this event, and I'd like to thank my colleagues in all the different coalitions for their help and support in developing the survey and writing the report, and design and editorial support to Deirdre Bouchery and Tracy Staskovich of Design Catch. Thank you very much.
Thank you so much, Frances, for your presentation. I'm glad we had an opportunity to share the results in such great detail and get an overview of really stark data that our member organizations had shared with us, and some of the outcomes we will be discussing today at our first event. So the next part of our program will feature panel discussions, and both panels will be facilitated by Dr. Fatima Cardoso, who is the director of the breast unit, Champalimod Clinical Center in Lisbon, Portugal, and the president of the ABC Global Alliance. And joining Fatima in the first panel to discuss the consequences of isolation will be Melanie Costin from Fight Bladder Cancer in the United Kingdom, Anita Granero, Oscars Angels Italia from Italy, and she's also International Brain Tumor Alliance from the UK. Luciana Holtz from Instituto Oncologia, and I apologize if I pronounced it wrong, who's joining us from Brazil. Susan Thornton from Cutaneous Lymphoma Foundation in the United States, and Lucia Travado, psycho-oncologist from Champalimod Clinical Center in Portugal. So Fatima, I will turn this over to you, and I would like to ask all of those participating in the first panel now to turn on your cameras, and remind the audience that also we have a Q&A available where you can ask questions to the speakers as well. Thank you.
Thank you very much, Alex, and also thank to all the panel members for your availability to be here and share your experiences with us. So in this first panel, we will tackle one of the most important consequences of this pandemic, which is isolation. And isolation is being faced by all of us, even by healthcare professionals. Despite going to work, we still are doing it so in a much isolated way and isolated from our families, with a lot of pressure, with afraid of bringing the virus to the patient, cancer patients, or bringing the virus to our homes. So isolation is felt by everyone, but nobody, as much as cancer patients, have been feeling this isolation as well as their families. And now it's very common that cancer patients have to come to the appointments alone, have to be admitted to the hospital alone, have to go through treatments alone. And this was not the case before the pandemic. So we will tackle some of these issues, and we will also provide some suggestions of how some organizations have found a way to support patients to fight isolation. So I'm going to start with Melanie Costin. So Melanie, within your organization, that just to remind everyone, provides support to bladder cancer patients, you have to support some older patients. And we all know that this online world is more difficult for older patients to adapt. So would you like to tell us how your organization overcome this problem with older patients and digital media, and also I would like you to mention how all these services that you provide and all this pandemic had also an impact on you and your staff. Please, Melanie.
Yes, it's actually a really hard time for people at the moment because most of the things are done online, and a lot of people, they don't have the knowledge about the technology. And not to generalize to say that older people don't know about technology. Lots of them have smartphones but have never really used them for much, and so they have to learn. And when you have cancer diagnosis, it's extremely hard to learn new things. It really is, to take things on. A lot of people have had no option to learn anyway because they've needed to get their shopping and bits and pieces. So you know, they are trying, but if they don't have anyone to help them, such as somebody who already knows, maybe a family member, you know, people aren't coming into each other's houses at the moment. It is really, really difficult. We started some online support Zoom meetings, and we spent a lot of time explaining to people how to use them. And I've sent lots of emails with instructions. And actually, this is a more fun side of it because a lot of people are doing it for the first time. And so we've gone through all the people talking on mute. We've had a lady who thought she was set up and was chatting away, and we were looking at the top of her head and the ceiling, you know, so we've kind of laughed along with people, and it's encouraged them because they can then, you know, have the confidence to have a Zoom meeting with their family. They've been learning new things. We've had people learning how to dance online, and you know, so there is a positive side to it. But when it comes to appointments, there's two ways of looking at it. I think if you have a general appointment with your surgeon or a nurse, it can be a really positive thing because you get quite a lot of time. I'm a patient myself, and I had about 15 minutes chat. I've never had that before. So these kind of things can be beneficial because you haven't got the added stresses of the waiting rooms, expenses build up, you know, parking fees, all the little things that people don't really think about unless they have to do it. But when it comes to a really important thing like a new diagnosis or some really terrible news, we've had patients who've had an option. They can sit at home and get the news with their partner, husband, wife, whoever, together online, or they can actually go in person, but they have to go on their own. And you know, some people, they've done this as a team throughout everything, and just to go off on their own to the hospital and sit there, it's not a nice situation. So I think, you know, there's two sides of the coin. There's some good things that are coming out of this, for sure. So, you know, the good side, I hope that we can keep that going, because it would be nice to get those kind of appointments where you can chat and ask the questions that when you're in a waiting room and with all the added anxiety, a lot of it goes out of your mind and you don't ask anything. So
thank you very much. And just to wrap up, the impact on you and your staff?
Impact on me and myself, well, I suppose coping with the burnout and stress, as a few people that know me would say that I'm actually not coping that well at the moment, but I'm really trying. As a patient, a lot of patient organisations have patients supporting others, and it does bring on extra stress because you have to learn to separate your mind of all the panic that's going on. And, you know, I've had procedures myself, so you can do that. I'm quite good at that. You have to set yourself boundaries, because when you're working at home, your whole house becomes your workplace. Everywhere I look is bladder cancer. And so you have to set yourself boundaries. You have to not look at your emails. You have to try and turn off. It's really, really difficult. You've got to take days off. And it can just be like the thought now, I would love to do absolutely anything. But if I take a day off, it's really enjoyable to do nothing, to have just lay there, do nothing, watch. I've watched all the Scandi Noir there is, so if anyone's got any suggestions, please send it my way. Forcing myself to go out for a walk, even though it's perishing outside. But the main thing is I'm focusing on the future and better things to come. last year we were able to go outside in the sun, meet people outside, have a picnic. I got my bike out for the first time in 15 years, so I'm looking forward to that. But I think the main thing is that something that's been quite hard for me is that you've got to share your feelings and don't be afraid of it. And, you know, my boss, every week we have a meeting where generally we'll be talking about work things, bits and pieces, catching up, but I'm allowed to have a good old moan session as well about anything. So yeah, I think find the right person and share your feelings with them.
Thank you so much, Melanie, for sharing that with us. So I will call now upon Anita Granero. And Anita, your organization is dealing with a group of patients that, of course, this isolation is so important, not just for them, but also for their parents. So could you please tell us how your organization has provided impact to pediatric cancer patients and their families, particularly the parents?
Yeah, hi everybody, and thank you very much for having me. Well, it was extremely challenging, of course, because we are very different from other organizations because our volunteers are totally integrated in medical teams. So they are really one member of the multidisciplinary team, and we are present every day. So we live with the families. And what was extraordinary, it is extraordinary in the bad way, of course, is that generally people didn't really think that the pediatric population was touched by COVID, that we had no real consequences. And on the contrary, it was and it is brutal because we had, especially in Italy, of course, we had the first wave and we were the most touched by this. In a very dramatic way, and like in a few hours, I would say, we had to empty the hospitals. We had to tell parents to go. You just pack your things and go. And we had children dying. We had children having to have surgeries the day after, really debilitating children, all sorts. And it was really heartbreaking, totally heartbreaking. But people didn't really realize that. I don't think they do realize that. There is a certain number of children, very low, but still quite a lot. I think it's about 1.8% in Italy of children in study that was done for 3 months that had COVID in the total of people that were infected, which is quite a high number if you think about it. It's about 3,900 children. But the consequences were really, the isolation was terrible, absolutely devastating for everybody. Also because the hospital sent all the volunteers away. And just to make you an example, we are at the Children's Hospital in Rome, the Bambino Gesù, which is a huge hospital that has like 2 million cases a year. So imagine the size of that. And they come from all over Italy, from all over the world. And I was the only one allowed it because we take care, because of our special position, of course, we are considered members of the staff. And and we take care of the, great emergencies also. But it was, everybody was gone. And the families, of course, in Italy, was very Latin we count a lot on the family. The family is very strong and it helps a lot. Helps with really basic things like food and all kinds of support. And then in 24 hours was totally lost, and it still is actually, because we're still on lockdown on and off and on, not being able to move from the towns or even from the regions, and that is extremely challenging. The thing that was the way we had to laugh to survive, to tell you the truth. In pediatrics, we do laugh a lot. And fortunately, even in that, because we have to laugh with the children. And what was really bizarre, it was that, we were going out in the world, in this really bizarre world. There was the COVID reality where nobody was there. I mean, Rome was deserted, and I was walking in and out of the hospital practically alone. with the army and the police around, but nobody else, because you had to have a special pass. And then you have to come into the pediatric, and then you have to just pretend that everything is all right. You have to create a world that does not exist because of the children, because you have to go on with them and try to make them believe that there's, okay, there is a problem, but it's not that bad. And they see, grandparents not coming anymore. So for that, thank God for technology, because it was extremely helpful. With the iPads, we could contact, brothers and sisters at home, and the actual class when they could go to school, all the members of the family. So that was wonderful. But it was very hard for all of us. And when I say all of us, of course, all the doctors and nurses, not just the volunteers that we were. And as a charity, it was devastating, of course, because we rely on the people. We are solely volunteers. There's no paid staff for us, but we rely on the donations, and also because we do help financially the families and the children for the very basic needs of food and transportation and sleeping. And that was practically impossible. So I think we pay the price as everybody else, but have to keep on smiling all the time, always, never give up. And we had to actually, I have to say that the community of charities like what we are doing now was extremely helpful, was so good, so very good. It moved fast. I'm very lucky because I'm a member of the IBTA. Our charities in France and Italy are members of the IBTA, and they helped us a lot in keeping in touch. And that was extremely helpful because we were cut from everybody else, really. And that was extraordinary in a way that I think we have to keep on going. And what you're doing today, I think, is very, very, very important. And I'm really honored to be part of it. And I hope we'll carry on.
Thank you so much, Anita. I think it is a wonderful image of going back from a bizarre world and pretend everything is okay within the hospital for the kids.
Yeah.
Thank you for your inspiring words and for the inspiring work of your organization. Thank you.
Thank you all.
Thank you. So I'm going to ask now Susan Thornton. And Susan, I would ask you to mention the very specific issues that people that have rare and complex cancers and complex diseases, these cancer patients usually already feel a little bit isolated and lost. So how was the impact of the pandemic for these cancer patients specifically? And how would your organization was able to provide support, not just for the cancer, but also for the COVID when someone has both? So please go ahead and tell us about your experience.
Sure, thank you, Fatima. In the rare and complex cancer cases, in the normal world, we tend to fall through the cracks. Many rare cancers go undiagnosed. They're hard to diagnose. In our particular cancer, we cross multiple specialties. So it's not only hematology, although it's a blood cancer, it impacts the skin. So you're talking dermatology. We have special pathologists. So on a normal day, it's really challenging to have a patient get the proper diagnosis, get to the proper specialist, have access to whatever treatments are available. So with the impact of COVID, you can imagine not only the logistical challenges that were added on top of what normally happens, but the stress, fear, and unknown from the patient community and their loved ones in trying to manage and navigate an already very complex world. And so early on, I think the fear factor, at least what we were seeing in our community and also in the rare cancer community, we're part of a number of other coalitions in that world, really had to run fast to try to support the patients and how they were trying to grapple with changes in treatment, changes in the fear of going to a facility if you were in treatment, not unlike other cancers, of course, but sometimes the services and the treatments in a rare cancer are also limited in location and delivery. So people were already traveling far and wide to get their treatments. And then to be able to grapple with, you can't even sit down and speak with your physician about the changes in your treatment pathway. So yeah, the challenges facing the rare cancer community, I think, are, again, not to say unique by any stretch, because I think it's impacting everyone, but I think it gets compounded. And from our perspective on the patient organization, I think our role in that, pulling together the clinical community and being able to address the questions in a way when there's a lot of unknowns. There were so many questions that no one had answers to, and doing our best as the organization that has access to other resources and information to pull those things together and create focused resources, documentation, or even we did some online Q&A programs with the clinical specialist where our patient community was able to ask their questions directly. I think those kinds of things, leveraging technology, using that word pivot, everybody pivoted, right? But I think being able to have the connection within the clinical community, and we were able to be the hub for the best kind of information, was so helpful to be, even if we didn't have answers, and we're still finding this today, now that people have settled in a little bit with changes in treatments and how they're engaging with their clinicians, whether it's via Zoom, online kinds of services and so forth. But now the questions are coming around about the vaccine. What do we do? What's the impact? Generally speaking, no one broke out a rare disease cancer patient in any of the clinical trials. And, again, now we're in this next phase of uncertainty, I think, around how can we best support our rare disease patients in the right way with the very limited clinical information that we have. And again, I think the key is really being collaborative with our other organizations that have information, so we are not having to reinvent the wheel. And then being very connected with our clinical community. We serve the global cutaneous lymphoma community. So, it's a very small patient population. Most patients rarely meet another patient, and in some countries there are no specialists. So, being able to pull together the clinical community, create layperson facing information that is easily accessible through the various digital platforms, and then providing opportunities to engage peer-to-peer. I think, as Melanie said, we also established online peer-to-peer networking groups where patients and their family members can engage with each other, which really helps to support that emotional component, and people can share how they're coping.
And let me ask you one particular question. So, because for this particular cancer, you need the help of dermatologists, right?
Yes, correct.
And let's forget the field of oncology. Overall, in general hospitals, that could be a specialty considered not prioritary, and that could be sent home.
Right.
So this, for these rare diseases where you need specific specialists, was that also an additional challenge?
Absolutely. Again, we have that challenge in a normal world, and the collaboration or connection with multiple specialties is hard depending upon the country and the scenarios, and even within one hospital, as you mentioned, they're two separate departments sometimes. So compounded, trying to bring together, I think that's where the clinical community is really important. To be able to, we're very fortunate in our specific rare disease that our multidisciplinary clinical community globally is very connected, generally speaking. But, it's limited. So trying to help individuals navigate within their circumstances, we have actually done some really, trying to connect patients with physicians directly who are really struggling because they're in a different geography or in a different country even. We've done a lot more of that kind of work. And because we are we have very good relationships with the clinical community globally, we're a trusted source. I think that really makes a difference in being able to facilitate some of those things that otherwise, these patients would just really literally fall through the cracks, and the consequences of that could be deadly in many cases. So you have to think outside of the box.
Thank you very much. Those are very crucial points, and thank you for the support that your organization is providing. And I'll take a little bit of what you said to move to the next panel member, which is Lucia Travado. And Lucia, you heard that so many of these patient organizations have gone over and over some of the fears, new fears that attacked these cancer patients, fear of the unknown, not just of the disease, but also of the pandemic and of the two together. So could you tell us about the psychological impact that the pandemic has had on your patients and on cancer patients in general? And what do cancer patients fear the most during this pandemic?
Thank you, Fatima, and hello to everyone. Yes, indeed, cancer per se is already a disruption from the normal way of life that our patients have. And the pandemic adds a second disruption that brings other kinds of uncertainty. And so our patients that usually already have a certain amount of anxiety due to the uncertainty and the threat to their lives that the disease and the treatments sometimes bring, had this over them to burden and to complicate their lives. In the beginning of all of us did not know what was happening, how could we manage? I mean, all of us, the world, right? The professionals and everyone. So there was a time in which it felt very unsafe to be a cancer patient, particularly undergoing treatment. So the patients who were undergoing chemotherapy and those in an advanced stages were the ones that fear the most and felt most anxious about what was going to happen to them. Also, one of the difficulties was that they could not bring usually the person, the caregiver, to the consultations, or if they were undergoing surgery or chemotherapy or other treatments, the other person could not come in. And we know how the patient is already a bit confused and anxious, and that disturbs the way they perceive information that all of us try to bring them. And not having the possibility to have that second pair of ears and support has damaged somehow their sense of being, and they felt somewhat more at loss. Of course, when things progressed and we got to know a little bit more of the pandemic and guidelines for treatment also changed, and so patients felt more safe undergoing chemotherapy and with the support that we could bring them, things lower down a little bit. But still patients, what they fear the most, Fatima, is that they get COVID, of course, because that is the unknown, that is going eventually, if they would have to go to the hospital, that is really going into the unknown because they did not know and their families what to expect. I remember a patient of ours that her sister had undergone has got COVID, and she didn't know, she could not speak with her for 6 weeks. She only got information from the healthcare professionals, and she got in touch with me because she couldn't handle it. It was the only family being that she had, and she needed help to cope with this distress of not knowing what was going to happen to her sister. But as I was saying, nowadays we know a little bit more, and the nurses have been playing an excellent work in calling for our patients and trying to understand how things were going. And that is has played an enormous role because everyone likes to receive a phone call at home to know how they are doing. And also the teleconsultations have proved a great way to reduce this anxiety that patients have. But
So let me ask you now for the last minutes for you to address a question that just came in from the audience. So they are saying, how do you think that all of us, patient organizations, and perhaps even caregivers, can prepare for what is coming? So vaccines are bringing new challenges and new concerns and new anxiety. And even with vaccination, we are not going to go back quickly to the way we were before. So how can we prepare both healthcare professionals, patients, and patient organizations in about 2 minutes?
I was just wanted to say that for the COVID, the things that they fear most is not being able to do treatment because of delays. But having said that, I will say that we have to reduce and lower our expectations. All of us has changed our lives and transformed into what is now called a new normal. All of us has had to rearrange our lives to be more at home and to do tele work and to be with our families and have to reinvent it ourselves more. I guess as healthcare professionals, we have to help our patients focus on what is the truth. What do we have that support us moving forward? For instance, for cancer patients, is letting them know what are the safeties, what do we know that can help them be feeling safe, because all the noise from the media is very disturbing. So helping them not to be attached to the media all the time, of course, is important. We also say to our patients, do little walks around the house. We cannot go far, but do that. Speak with your friends. Do not isolate. Speak with your friends, with your family, even though if you cannot see them, but use these resources. Use therapies of mindfulness and relax so that you can feel your equilibrium and reset yourself into this harmony of being okay. I'm okay. My fears are just in my head. They are not a reality in the meantime, right? So lower the expectations and really perceive that we have been undergoing this so far. So we hope to be able to carry it on further. And as someone pointed out, to learn the lessons that we can take from these challenges and this crisis that we have been facing. Crises are always a good period of making new things, thinking out of the box, and we can always take something forward and take lessons. So I hope this was
Thank you.
helpful, Fatima.
Thank you very much, Lucia. So it's in the second panel, we're going to discuss an issue that is very related to isolation and that already we've been tackled a little bit, which is new communication tools that we can use both between the healthcare professional team and the patient, but also the patient with their families, caregivers, friends, and also with the patient organization. How can the patient organization use these new communication methods to continue to provide support? So we are very fortunate to have with us Kirsten Pilati, representing Breast Cancer Network Australia. Lucia will continue with us in this second panel. Gus Vanderbosch from the Netherlands, he will be with us also. We have a second Fatima in this panel, Fatima Zelada Arenas from the Pancreatic Cancer Action Network in the US, and Jenny Cheng from House 086 in China. So, Kirsten, let's start with you and ask you to share with us some of the important, well, I was going to start with you, but perhaps before I go to you, I'm going to ask Lucia just to set the scene regarding these communication issues. And Lucia, I will ask you to, you were already mentioning about telemedicine and teleconsultations. Have the patients embraced it, or has this been difficult for the patients? And also how, for example, in your field, psychology, how have you been able to cope to continue to communicate with the patient and their caregivers and families?
Okay, thank you. Fatima, that has been the biggest surprise. I am so happy that we have all this technology to support us keeping in touch with our patients and the families, because otherwise we will be really isolated. The patients loved it, and we can do, as a psychologist, what we do is talking with the patient. So for us, it was really easy to keep in touch, and we gave a chance for the patients to choose either by phone, by WhatsApp, by Zoom, what means they had available. Of course, by telephone, it's easier for someone that you already know, of course. But if the patient does not have any other means of communication other than that, they accept very well the telephone. And even for patients that I do not know, it has also done its role. So I think that's something that it will stay, and we learned and overcome all the barriers that were there. I remember we wanted to do consultations by phone because we have patients in the islands and that live far away from the clinic and wanted to do that. But there were so many difficulties regarding protection, data protection, that no one really authorized this. And all of a sudden, this was not an issue. And the issue was really to reach out to our patients and make sure they were okay, they were safe, and that we could address their needs as best as possible and give them the response that they needed. I think the future will have to encompass this as well. I think this.
Let me, before you go to the future, don't you think that there is a limit to teleconsultations?
Yes, of course. But nowadays, I have to tell you that patients nowadays ask me, I prefer in-presence consultations. And this is mostly because we became also their family. They don't see that much their families, and they feel safe in the clinic because they know that we comply to all safety procedures. So, and they say, you are almost my only social life that I have, because I see all my relatives and friends by WhatsApp or whatever. So a lot of times they prefer to go to the clinic. Of course, there is a limit for these kinds of communication ways, but it's something that has come to stay. And I think, for instance, as far as e-health and e-health programs that have been developed, but in a slower pace, I think that we need now to put more effort and investment in creating resources, other resources in e-platforms that can help some psychoeducation, education about other the disease, the resources, etc., that are already there, but now the patients feel a bigger drive to go there and take use of that. They also have faced that they are able to use them. As someone was saying, sometimes you had to teach in your organization patients to use those kind of technologies, but now they are using them. And so I think that's what we need to move forward now, is really to create additional resources that go through these means online, for instance, to give them opportunity to not have to lose time from work and from family to drive to the clinic for certain kinds of consultations. For
So
sure,
maybe
give
a
them
mixed
open to them. Yes, a mix.
model to go forward.
Mixed, Fatima, for sure.
Yes. So last point I would ask you to briefly address is what about the families? How easy it is to incorporate the families in these tele appointments?
That is really interesting, because our patients are very possessive of us. So they are not so eager to share us with their family members. So that's a difficult for me, because I usually see women and I like at least to see their husbands or partners at least one point in time, so as to let them know that they are part of the team, for sure, the support team of the patient, and we need them to understand what we are doing in the clinic, and as far as my strategies to reduce anxiety and to reduce sadness or depression or despair, they need to be part of it. And so I need them in the consultation at least once. And because of these restrictions, this has made it a little bit more difficult. I think that we have to stretch a little bit our ways of reaching out to them, but that's the difficulty that I have. The other difficulty, Fatima, and we have not mentioned that in the other panel, is for patients who are dying and in a very advanced stages. Those are the ones that suffer the most. No one wants to have an advanced cancer during the pandemic. There are so many things that they would like to do that they are not able to do, be with family and friends, and to die alone. No one deserves that. So that is the thing that I think it's the most touching, is to witness those phases. And all of us have faced that in our clinic, and that's nothing that replaces the family and the support and the caring.
Thank you so much for mentioning that.
You're welcome.
As you know, that's very dear to my heart, and our organization is also trying to improve the way that advanced cancer patients can still receive support. But like you said, nothing takes away the presence of family and friends and the ability to do things that you always wanted to do. And now with all these restrictions, it's very, very hard for advanced cancer patients.
And it's an ethical dilemma for the healthcare professionals not being able to provide that. I'm
True.
sorry to bring that up.
No, it's true. Thank you.
Thank you,
Lucy.
Fatima.
Thank you. And we move to Jenny Chang. And Jenny, you come from China, and China was the first country to respond and to have to respond to this pandemic when nobody knew what to do and nobody had advice to give you. So how was it for your organization to be able to reorganize and to provide the care and support that cancer patients needed in China? And also, if you can address also something you have learned, and I think it will be very useful to everyone, is what type of internet communication patients and caregivers prefer. So please, Jenny, share with us your experience.
Thank you, Fatima, and thank you for having me here. In China, I know at the very beginning, it's quite difficult for all patients to see doctors face to face in hospital. So it's very important for them to have a channel, a communication way to connect with physicians. And our organization, we are a lymphoma patient supporting group, and we founded in 2011. In the very beginning, we started by a website, and then we have app, and then we gradually learn how to communicate with patients in their favorite way. It's because in China, people always like using WeChat. It's a social media just like WhatsApp, but with multiple function. And I think the most helpful thing we did for patients in pandemic, it could be building the real-time connection between physicians and patients. We holding more than 100 webinars and live streaming for patients and caregivers and physicians, and more than 60 lymphoma experts, and a total of about 10,000 patients have participated in the interaction activities. So these webinars were live streaming, like the patient own opportunity to ask questions, and also they will feel physicians are there, they can connect with them, so they feel more safer. And in China, internet industry has been developing rapidly for the past 10 years, and people are getting accustomed to online communication. User-friendly and real-time interactivity were ranked as the 2 factors when they choose communication tools. So the most popular social media, WeChat, is the first choice for patients and also for our organization to communicate with them. But before pandemic, only our organization uses to build a patient group and to keep connection with them. But not so many hospitals or physicians, they have this awareness they need to also run this kind of WeChat group or use this functions to help patients or connect with patients. But because of the impact of the pandemic, the entire medical industry raised the awareness of the importance that we need to keep touch with patients. So there was a big change in 2020. Hospitals or pharmaceuticals, they quickly started their online process. Many of them to operate their own WeChat
platform and use weight media, that's a subscription account to spread information. And for us, we also learned there's a new product of WeChat. It's called Enterprise WeChat. It providing service for institution and very suitable for us because we have been able to serve patients by new ways like text ID. We can add subtypes or their locations or treatment status or other informations adding to the WeChat of the patients. Then it helps us can stratify according to different tasks. It's very effective when we want to collect patient data, want to send them the patient survey. And also it helps us sending information to people who need it because we know who is which kind of subtypes. There's also another function called return receipt. So before we use this tool, we send information and we need to bother them to ask them whether you read it or not. But now with this function, we will know immediately whether patients check or read the information we send to them. So it can release a lot. So it's a very friendly function for serve patients. And a very big change about before pandemic, we initiate webinars to let physicians sharing their knowledge, but not physicians or pharmaceutical. They initiated this kind of activity. But in pandemic, we cooperated this kind of live streaming or webinar together. Most of our webinars were co-hosted by hospitals, physicians, pharmaceutical companies. Thus, all of us work together to build a bridge between patients and experts.
Thank you very much. I think what you're mentioning about this collaboration between everybody and engaging everybody so that the patient feels supported and has this two-way communication between the patient and the patient organization, or between the patient and the health professional team.
Yeah.
So thank you very much for sharing your important insights. And Kirsten, I'm now calling for you to continue this issue of importance of having trusted information and to continue to provide to patients trusted information. Would you want to share with us the experience of Breast Cancer Network Australia?
Of course, thank you, Fatima, and a very warm morning here in Melbourne, Australia. And I firstly want to really acknowledge what's going on in other parts of the world, because Australia is doing extremely well when it comes to the impact of coronavirus. So what I am talking about is really the reflections of when we went into a very hard lockdown in March, rather than what many of you will be seeing if any of you get to watch the Australian Open tennis, where you'll see people probably unmasked and watching sporting groups. So I feel for all of the patients and the health professionals who are doing it tough in other parts of the world. So what Breast Cancer Network Australia, we are here to support Australians affected by breast cancer. And our role is to inform them, is to connect with them and to be the voice for them. So our absolute focus is on the patient. And so in March in Australia, we went into the uncertain times like many others did. And what became very clear is that patients needed some kind of certainty, and they know where they had no idea where to go. So what was happening was health professionals' telephone lines were being blocked up, and health professionals couldn't give patients any real direction or information, and so too were hospital lines. So BCNA did two things. One was to open our helpline, which is staffed by oncology specialists, to 7 days a week, so that we could take the calls, and we weren't necessarily giving people information directly about their own personal experience, but we were kind of being that voice that people could just listen to. And I think patients really needed that during that very uncertain time, just a safe place to kind of talk about their anxieties, and then we could help them to navigate the system. But the other really important communication tool we did was we already had an online tool, or it's called the My Journey online tool, and you can find that through our website. But it's an online app that works in real time and can provide information directed to a patient for their specific situation. So here in Australia, whilst there are many policy decisions made nationally, the states and territories all deliver their health services in a very different way. So we wanted to find a place where we could give trusted information that was specific to what each patient was going to be enduring around the lockdown for their states. So while some states were operating in a pretty normal environment, others were in severe lockdown. And so this online tool allowed us to provide specific information to the person depending on where they lived. So if it was in regional areas, we were able to provide different information to them. And I think what Jenny talked about before, that collaboration was essential in these early parts and continues to be today. So all of the cancer patient groups that provide information and support came together, and we continue to hold weekly meetings so that we are all delivering the same information that is accurate and up to date, but means that the patient is not getting multiple messages from different locations. And so for breast cancer patients, we became that trusted source. So we were having up to 10,000 people per day come into the online tool. Now, the advantage that the tool gave us was not only that flexibility to be able to deliver the information depending on where you lived, but it also meant that we were updating it after every health minister made their announcements of what the new rules were, or every hospital was changing visitation rights. And it really, because we understand what the patients wanted and needed, it meant that we could adapt that information specific to them. And I think the telehealth is an excellent example, because health professionals, for the most part, telehealth has been an incredible step forward for us. It happened faster than we'd ever wanted. And here in Australia, with the land being so large, telehealth is really important for our regional patients. But it also threw up many challenges that we could address straight away to patients. How do you prepare for a telehealth meeting? How do you know when you should have a telehealth versus actually insisting on a face-to-face? You know, when you're meeting a clinician for the very first time, that bond and connection is so important. So if it was safe, we were encouraging people to go into the hospital to have that initial meeting. We were letting health professionals know that we had an absolute expectation that if you were progressing a cancer, or letting a patient know that their cancer had progressed, or you were newly diagnosing someone, that telehealth experience had to be very different to someone where you already have a rapport with. So making sure that there is a support person in place so that they're not being delivered that information in the family room with young children around. So I think that's the other real tool that our My Journey online tool provided, was we could instantly respond to the issues we were hearing on the ground from patients. We could let health professionals know that, but we could also deliver very specific information for people around Australia at the time when they needed us.
And what about moving forward? Are you planning to keep the tool?
We sure are. So the tool has always been, or is a really important part of BCNA's information delivery service going forward. And it has information on every aspect. So when you come in as a patient, you identify what type of breast cancer you have, and then you are only delivered the information and the treatment and care that's specific to that information. So we will now continue to build on that. We have close to 20,000 people participating in it, but we're also doing what it allows for is things like Jenny was talking about, those webcasts and information forums. It means we can put those on the tool and they can be there for much longer, so people can watch it at the time that's right for them, rather than needing to click in at that exact moment in time when they might not be ready for some of that information. So for example, next week we have a fear of recurrence webcast, which includes a patient, a health professional, and we had more than 2,500 people register for that event within 24 hours. So we absolutely know what the response is, what people need, and we can keep delivering that in a pretty cost-effective way from an organisational perspective. But it means it's going to be there on the tool for all of those people who are up in the middle of the night worrying about their cancer progressing.
Thank you so much, Kirsten. Thank you for showing the pros and cons of having everything online. So I will move now to Fatima Zelada Arenas. So Fatima, your organization deals with pancreatic cancer, and I would like you to first also tell us if there are specific challenges from the point of view of the patients that you provide support to, and also from the point of view of your organization, what were the challenges, but also the accomplishments that you were able to do when moving online.
Of course, thank you for the opportunity to participate in this wonderful panel. We definitely heard a lot of different challenges that patients were facing, a lot of what some of my fellow panelists have shared already, particularly around fears and concerns about going to the doctor for appointments, whether or not they should continue with their treatment. We had some patients that had difficulties accessing surgery and clinical trials as well. So those were some of the challenges that we were hearing from our patients and our caregivers. As far as some of our challenges, we very quickly had to adapt to an online environment and really move our operations. We have our call center where we serve patients and caregivers, and they're able to contact us, ask any questions about the disease. We can connect them with specialists and really give them vital information for managing their journey. So we very quickly had to adapt all of our operations and make sure that we were equipped to make the transition, make sure that our team had the technology that they needed to be able to work in a remote environment, make sure that our systems were secure to protect the confidentiality of our constituents, and then really adapt all of our policies and procedures appropriately. But I think at the end of the day, our focus was really making sure that we were available to patients and caregivers. We didn't want to see an interruption in our services. And that really drove us to move really quickly and make the transition as quickly as we could. So we've been able to support patients, I think, the pancreatic cancer community, and really provide them with the resources that they needed throughout the pandemic. We also developed a lot of resources that were specific to COVID-19, really because we knew that the community was going to be asking us questions about it. So that included, making sure that we were adapting based on what they were asking us, what their main concerns were, and really just making sure that we were staying on top of everything that was coming out about the pandemic to be able to be that voice for our patient population and making sure that they were informed and really giving them the information that they needed and trying to support them as best as we could. I think in terms of some of the, the positive things that came out, we were able to really provide more opportunities for our community to engage with us online. We offered a lot of additional webinars, particularly on topics around COVID-19, so that they really were able to have access to experts who were talking about what was going on with the situation. And really, it took a lot of outside the box thinking and making sure that we were able to engage with our constituents in new and unique ways. And then we had to move all of our in-person events online, just like everyone else did. So I think that was also a challenge. We wanted to be able to keep that engagement up because that's really important for our organization, because we have so many different populations that we serve: patients and caregivers, volunteers, healthcare providers, researchers. industry partners. So I think we did a good job of adapting and really trying to maintain everyone as engaged as we could, kind of given the situation.
Since you mentioned about clinical trials, and because we all know that pancreatic cancer is one of the toughest ones, and new treatments are always in great need, do you want to tackle one question that came from the audience about the impact of the pandemic in clinical trials for cancer? Do you think that it was harder to find an open clinical trial for cancer patients?
Definitely. I think at the very beginning, that's something that we were actually hearing from our patients and caregivers, is that they were reaching out to sites and that a lot of sites were closed. You know, they weren't able to actually go in. I think that we've seen a shift now, you know, kind of almost a year into all of this. And there's been adaptability of telemedicine consultations that a lot of the panelists have shared, but definitely at the very beginning, that's something that we were hearing was a challenge for our patients. And, you know, as an organization, we really think it's important for patients to consider clinical trials. And so that was a challenge for them to be able to just connect with sites. And even if they were interested in a study, you know, making sure that the study was open and that they were equipped to kind of be able to take that patient in. That was really hard at the beginning of the pandemic.
Thank you so much for sharing with us. And I will move to Gus. And Gus, I would, so your organization was already, had a lot of online activities already and online support. So was it easier for you to do this transition during the pandemic? And was there any specific type of support that you created, for example, to help those that were not so at ease with online technology? And also I would like you to tell us about the collaboration that was established within different cancer patient organizations in the Netherlands, and how they came together to help support cancer patients through COVID.
Yeah, I would like to start with the second question. We have a federation of cancer patients organization in the Netherlands called NFK. And what we tried also in the COVID crisis was to work together as a unity, as a federation, on coping all the problems and the questions on for cancer patients during the COVID-19, still going on COVID-19 crisis. Today, Dutch Cancer Register published the numbers of cancer diagnosis dropped about 3% last year compared to 2019, and especially breast, prostate, and colon cancer dropped severely. So that indicates that patients were less eager to go to the hospital, and we together focus on issues like that. So in newspapers to indicate that people should go to hospitals, etc., etc. So that collaboration is, I think, very important. So we don't have all those different mailings and news items, news reels that might be disturbing for patients. And we continue that in 2021. Which also means that when people ask questions to our organization about COVID and about treatment, generally we indicate that the answers are being found on the websites of our federation and not on especially our own website. So that's a way you have your information at one spot, what I prefer, instead of information all over the place. So that's a very good, effective way for collaboration. On the other question about digital information and meetings, maybe it's a little bit too positive to say that we had a lot of experience. We did do webinars, etc., in the past, and we use YouTube, etc. And we try to have more digital meetings with patients, with volunteers, That's by and by is developing right now, but especially for people who are not so used to use the instruments like Zoom and WebEx or Teams, they're not eager to collaborate to join meetings like that. So what we also did was to give people the opportunity to do a tryout. So if you want to join a meeting but you're not sure if you can manage that, then you in the days before the meeting, people could try, and generally I helped them out. How do you use your microphone? How do you use a video? So not just the top of your head, and put them on mute, etc. And no worries, as they would say in Australia. No worries, we'll get there. But in the end, meetings that would generally, where we generally have 60 or 70 people live together, now we had 35, so there was a drop of 50%. And many people still prefer to see each other and see each other live. So the new possibilities that we have now and that we use, and we're going to use them more this year, will not be sufficient to connect, especially patients with each other. So there's a lot of work to be done.
Thank you very much. I think you're totally right that still not the same as being face to face, and particularly when we're trying to support each other. So there's still room for improvement in these new technologies. Thank you for sharing, and again for stressing out the importance of collaboration. And that is very interesting, of the one-shop information for cancer patients. Very, very useful experience. Thank you, Gus.
Yeah.
And just to tell the audience that unfortunately we didn't recover Luciana, so I cannot go back to her because we for issues of connection. So before we close the panel, I will just go back to Kirsten and help her finalize by saying, if you have any specific support for metastatic cancer patients, particularly since what Lucia said, these are the most difficult ones, the ones that are being facing the worst consequences of this pandemic. So what can we do to help them, Kirsten?
Thank you, Fatima. And as Lucia said, these are the group of women and men that need our support the most, and have been, to be honest, the most challenging for us to be able to help in a practical way. Here in Australia, in fact, from a palliative care perspective, if you were a patient in the hospital palliative care, you were allowed no visitors. And in fact, in some states in Australia, that is still the case. And it's been one of our very big advocacy points, because I know that, you know, from our discussions at the Global Alliance in the US and the UK and in Europe, they were still allowing what I think is a humane approach to the end of life, to allow people to be with the people they love the most. So it continues to be a challenge for us here in Australia. And so we have been doing a lot of advocacy. Once again, as Gus said, you know, bringing people together to advocate. So you're not doing it in specific tumor streams, but actually showing the strength of a community to try and implement change. But also helping people, even with the telehealth approach, of helping them with the simple things of how they can connect in with family becomes very important. So we were trying to provide information in a much more practical sense for metastatic patients around how they could connect with people. And the other work that we've been doing is about the investment that governments needed to make in community palliative care to help people stay at home, but be comfortable and be surrounded by people that they love. And that's not just around the supportive care element, but that's also around the drugs that they needed access to feel comfortable. And so it became a very united front of all the cancer groups coming together to demand government step up and look after these people who have contributed so significantly to our community, that we needed to make sure that they had the best death they could. And it continues to be a real challenge for us. But also, you know, the anxiety was really interesting for us when we brought metastatic patients together. One of the nice things, and I know they said the same at the Global Alliance, Fatima, was for the first time, the rest of the world understands the uncertainty that they live with every single day. And so they really felt some comfort in being able to connect with people who could now all of a sudden understand what they have to go through, the highs and the lows and the uncertainty that they deal with every day. So there's always silver linings, but I think that the most important aspect is about coming together and being really clear on what is going to be the most impactful to help the patients through in the best way we can. And we can only do that if we're working together. And I think, you know, Gus has absolutely outlined the importance of collaboration. In fact, everyone has tonight, you know, the importance of collaboration. So yeah, I think we've still got a long way to go for metastatic patients. We always have. It's, you know, it's about shining a light on those women and men who need us the most. And we have to always remember that as organisations that advocate for patients.
Thank you, Kirsten. And that I think it is a very good way of ending these panel discussions by emphasizing that collaboration is crucial among all our organizations. We can learn from each other, learn from mistakes and learn from things that work. And also collaborations between healthcare professionals, patients, patient advocates, pharma, governments, everyone, because this is a tough journey that has become even tougher with the pandemic. And there are things that we can fight together, particularly like Kirsten was saying, palliative care, supportive care, close to home. This is something we can all fight together. So it has been my pleasure to moderate these two panels. And now I will give the floor back to Alex for a few closing remarks. Thank you to all panel members for your excellent interventions.
Thank you, Dr. Cardoso, for leading these insightful discussions today. I realized that I didn't have a chance to introduce myself just earlier on when I had to take over from Lorna, but my name is Alex Filichevas, and I'm the Executive Director of the World Bladder Cancer Patient Coalition, which is a member of the GCCN. So I'd like to also say a big thank you to all of our panelists today who joined us to share the personal experiences from across the world. The impact of the pandemic was felt across borders, and so our challenges are truly global. That's why it is so important that we were able to bring together our communities from different corners of the world together today. And your stories, I think, helped also to illustrate the findings of the survey report that Francis shared today. And I hope we brought forward some learning opportunities for people in the audience and each other within the panels as well, and sparked ideas amongst the community on how to face the ongoing challenges presented by the pandemic and build our collective resilience and continue our essential work that is now needed more than ever. And after all, this was the very reason the Global Cancer Coalitions Network came to be. When back in spring, we were facing the very first wave of the COVID-19 pandemic, which was frightening for everyone. 9 international cancer patient advocacy organizations joined forces to share insights, the struggles, and the learnings in order to benefit our member organizations and the patient communities that they serve. And as Francis mentioned, our first survey in June 2020 showed a disturbing picture of then current and projected challenges faced by charitable organizations who provided a wide range of services for cancer patients and their community, including funding of research and health professional education as well. And at the end of the year, earlier today, little has improved. We see the majority of organizations providing essential services often adapted to the online environment with reduced budgets, staff, and volunteers for a patient population whose needs in terms of support and information have increased significantly. And we've heard today in these fantastic discussions that cancer patient support services are often run by cancer patients or survivors and caregivers. And these are the very people particularly affected by the pandemic themselves. And for the many organizations who do rely on volunteers to deliver support services, the crushing effect of the pandemic on patients and their families have left this once vital source of support vastly diminished. And it will take time and effort for us to rebuild that. The psychological impact and risk of burnout has affected many staff and volunteers in many organizations across the world who already cannot afford to lose more people in very small teams that they work in as it is. And that impact extends beyond our organizations, affecting patients and families to whom uncertainty brought on increased anxiety and suffering. Healthcare teams who provide care for patients are affected as well as suffering from exhaustion, and many others as well in our communities feel the psychosocial impact left by the pandemic. And whilst the increasing needs for adapting communication methods were challenging for many, it is inspiring to see the determination that we've heard today of organizations who responded to the survey, found the means to do so, and to also learn and take the time to educate others and share that knowledge. And providing right information in an accessible way, especially last year at a time when there were a lot of gaps and unreliable information last year. Organizations work together with each other, with healthcare professionals, partners, and academia to bring reliable information in lay terms to make it accessible to patients and families. We've also heard today how digital solutions helped healthcare professionals provide support and care to patients. And accessing digital support services is easy for some, whilst it may be a barrier for others. And it is something that was highlighted today, and it is important that we must not forget that as we become more digitally first in the care and the support that we deliver. But we have heard also positive outcomes of digitalization today, where organizations were able to reach more patients and support wider communities than before. We've embraced these existing technologies and found to use them in a better way, and found new ones helping us become more efficient. So hopefully helping us support and serve our communities better in the future. So the need for support for patient advocacy organizations has never been greater as it is now. And those who provide such vital care on the front lines are in a really perilous situation, as the report shows. And the services they offer often complement or even replace, in some cases, the healthcare services that have been displaced by the COVID-19 and are an important lifeline for patients and their families. It is imperative that emergency funding be made available so these vital organizations can continue to provide this pivotal support, and community support is also essential here. So as a GCCN, we would like to provide that opportunity to highlight these challenges and share the different ways that were embraced by the organizations to face these challenges. And as the Global Cancer Coalitions Network, we will not stop with this meeting. As it was mentioned, it is in fact our very first, but not the last. And our survey report and our communities have uncovered many important areas for international and multi-stakeholder discussion that we have had today. So just before you go, and if you haven't yet, I would like to invite you to share your thoughts on which topics we should focus on in our next meeting and future meetings. You should be able to see the poll on your right on your screens, and you are able to select 3 topics that you deem most important and most interesting for you that we should bring up already. So we can see some of the results already from the respondents who have done so far. And we can see evenly distributed 3 most important topics here that you think we should address at our next meeting. Ongoing sustainability of patient organizations and best practice sharing have come out as one of the top 3. Recovering from psychosocial impact of COVID-19. And I see the third one, also adopting innovations, learning from the pandemic in terms of innovations to use in the treatment, care, and support of people with cancer. So if you haven't yet, I invite you please to share these, to select your top 3 areas that you would like us to focus on. And you can continue doing so. We will have the results available for us afterwards, and we'll make sure to reflect on that. And I would like to thank you so much for your input and suggestions. As I said, the Global Cancer Coalitions Network is there to share knowledge and learnings and support and uplift each other as we work towards rebuilding resilient cancer patient advocacy organizations together. This was the first of the series of Coalition Connection events, so please look out for our future sessions in the coming months, and I look forward to seeing you all at our next meeting. So thank you for joining, and I wish you a good morning, afternoon, and evening wherever you are in the world.
Goodbye.